Thank you for coming to talk about the role of self-silencing in women as it relates to fibromyalgia. There is incredible link in the research to functional somatic disorders with the chronic widespread pain that is associated with fibromyalgia. That's incredibly impactful in the functioning in the life of women because of the high rating scores often found in those suffering with self-silencing and self-sacrificing. When rating scales of self-silencing and self-sacrificing have been measured, they have found the correlates between them, such as the Bacon and White study, with adverse childhood experiences being high and self-silencing and self-sacrificing being high, along with high scores on the pain and the symptoms associated with fibromyalgia. And as we look at this information, I think what's really important for us to understand is that speaking for themselves and speaking to their providers to get the care that these women need and so desperately need sometimes comes with a lifetime of trying to meet what is often called in the literature the good woman standard that has taught these women that in order to be socially approved of and to belong and get their needs met in any fashion, they need to sacrifice their own voice and their own self and their own needs. And that this sacrificing of their voice and needs and being subjugating the self to others is a way for them to be valued as a member of their family, their community, their culture. And they need to refer to this authority figure on their own lives and their own health and their own symptoms and realities. So it's really important that we understand that. And we looked at the studies with the cognitive self-efficacy relationship and how that affects the pain and how it interferes with the health of these individuals with fibromyalgia. And a lot of what we found is that 80% of these autoimmune cases in the research that are having trouble with their pain are women. And a lot of that has to do with the prevalence in women as the gender that is dealing with all the psychosocial and relational factors that lead to that habit of suppressing their needs and emotions and desires in relationships and contributing to them having chronic conditions where their own needs haven't been met and their health is suffering because of it. And so when we look at low self-identity, high levels of anxiety, high levels of depression, the suppression of these emotional reactions and needs and the lack of the trust in their own ability to use their voice to be heard and acknowledged and supported is such a huge part of the work in supporting these women that have fibromyalgia. If we want to provide best practice care, we need to be aware of this and how this relational dynamic impacts outcomes. When there is relational trauma and there's a history of being shut down and not heard or acknowledged, this can impact the woman's ability to continue the conversation when they see in you as the provider any note, verbally or non-verbally, any sign that you don't agree or that you have a different view. And so, as a professional, being aware of this in best practice care, we have such a powerful position to either encourage these women to say what it is they're experiencing in their body and to share what the symptoms are to them without assumptions and without speaking on their behalf, and give them that honor that they are the ones that live in their own bodies and therefore are the ones who are most able to speak to what's happening in their own bodies, supporting them to express themselves and not defer to you as the professional and shut down their own ability to share what it is that they are feeling and needing. It's been shown throughout this literature that what they express and what they're feeling and needing can be heard and encouraged with the trauma-informed care and not deferring to you as the expert on their own body that they live in. What can happen is that there's amazing physiological and nervous system regulating results that can heal and can help to reduce inflammation and to help them to be able to claim their own body and the hypersensitivity in the transmitters in their body that affect them to feel such incredible amounts of pain can be impacted by them feeling safe and heard and lower that level of inflammation and help them expressing their needs and their feelings, moving past any shame, guilt, Sometimes anger and resentment can be held in the body of not feeling seen, not heard, and acknowledged. And so working to have their views and their experiences validated can support lowering their symptoms and lowering the impact of those symptoms on them and their sensitivity to them, increasing their quality of life. And so, with this increase in quality life, and also in well being and functioning, there can be an increase in self esteem. And this can intensify their ability to feel mirrored and heard and feel more in control of what they can do in their body to help themselves. And so, with this work, we really want to be present and support the women to understand that their feelings are valid and that what they're feeling and experiencing is important, that it is heard and understood. I'm just going to move down here on my poster to speak more to the discussion elements of this and the impact on how we provide care. So this interaction, psychologically, relationally, neurobiologically, that the literature shows needs to be understood fully in the care of women with fibromyalgia and understood at that biomedical level of how the systems of the body react to safety and how they react to the individual being able to tune in and feel heard. And that this attachment system that surrounds self-betrayal, self-sacrifice, self-silencing can be a barrier to recovery. And these real valid feelings and concerns that the individual has that they haven't been able to have expressed and acknowledged in the past can contribute greatly to their suffering. And so as we look at this relational piece and the physiological, neurobiological processes that are taking place, the signals of pain that are incredibly distressing, and the suffering of these women, their therapeutic interventions as a care provider need to involve us giving them space to be authentic and express themselves and showing them compassion and showing them that assertiveness will be valued and that we want to hear views that are different than what we may suggest is happening within them, and that we will support them in their distress and help them to be aware of what it is that they need and tune into their own bodies as to what it is that will be best for them and empower them to heal mentally and emotionally and physically. And so this work is really deeply connected in our ability to listen and be present and consider the lens of the patient in front of us and being patient-centered, using somatic tools, having trauma-informed lens in our care, using relational neurobiological tools, interconnecting healing and recovery as a process that can have powerful outcomes when we work with our clients in a way that builds a secure therapeutic relationship and really allows them to express themselves and come to the conversation empowered to be heard for what it is that they feel and need, and to support them to take the space that they live in, that is their own body, and express the realities of it. Thank you so much for coming to the presentation today, and I hope that you found it meaningful. And I look forward to opportunities to collaborate in care and support this framework and this structure of care where we are using all of the best practices that we can in supporting women suffering from fibromyalgia and psychosomatic disorders.